Max, another mineral, in fact one that we hear an awful lot about, is iron. What can you tell us about iron?
Well, you know, iron in the studies of the U.S. population, and actually data from around the world, is the most often deficient mineral in the diet. The iron has a very, very important effect. It's involved in all red cell production of hemoglobin, so it's important to the blood's ability to deliver oxygen to all of your body tissues. So it's a critical mineral, and one that we really need to make sure that we're getting enough of. People in this country have heard some horror stories about too much iron, and I've talked to a number of researchers about this. In particular, Dr. DeSilvestro at Ohio State. I had him write an article about this fear. And what he has found in his clinical research is that really it's very difficult to get the amount of iron that's going to be damaging to you or I unless we have this genetic disease called hemosiderosis. And in those people, they don't handle iron properly, and because of that, they get excessive iron stores and things such as that that can be very, very dangerous, damage your liver and that. If you don't have the hemosiderosis in your family, you probably don't have to be fearful of that. But luckily today, if you really were worried about it, they have blood tests that will tell you whether you have this problem or not. And if you're really concerned, go talk to your doctor.
Mm-hmm. There are people, women especially, who have some higher needs for iron. And as you were mentioning, the situation about the fear of iron, in some cases we've seen some perhaps misguided feelings where products designed for women actually didn't contain iron, particularly women in the childbearing years, or even pregnant women. And that seems, as you said, to be doesn't make a lot of sense.
Right, and you know, the iron needs of people vary, you know, during their age span, especially in women. Of course, any children of rapid growth stages need iron. It's a critical need. Having anemia when you're newborn and things such as that can have a major impact on your development, very, very huge impact for the rest of your life, because it's important to CNS development, things such as that. And if you don't have proper neurological development early on, you really can develop some problems and not have the learning potential that you should have and things such as that. So children, people that are growing should be getting enough iron. Certainly women who are of childbearing age, who have, you know, of course, menstrual flow and things such as this, will lose and turn over more iron. So they really should make sure that they're getting enough iron. Women, of course, during pregnancy and lactation, breastfeeding, need to be getting enough iron as well. Those people in particular really, for the most part, unless they truly have this hemosiderosis problem, should really consider taking an iron supplement and take a nice modest dose of iron every day. Taking 10 to 15 milligrams of iron during those stages of the woman's life is certainly a decent recommendation and a safe one.
Now, obviously, iron is in our diet, particularly in things such as red meat and so on, but either vegetarians or people who are cutting back today on their intake of red meat then may need to look at another a supplemental source of iron. There are a lot of different sources out there, but can you speak a little bit about that, and of course the chelated iron as well?
Well, you know, as I mentioned earlier, iron is one of the biggest percentage deficiencies in terms of the populace that is deficient. Typical iron salts like ferrous sulfate are not as well absorbed as the iron you'd have in meat. And what we found is that the iron in meat is naturally chelated in the meat, and the iron in meat is very, very well absorbed, much better absorbed than the iron that you would get in something like a vegetable like spinach, which has a very low bioavailability or poor absorption. The Albion iron is an iron glycine chelate. It is basically mimics the way you would get your iron in meat in this chelated fashion. and the absorption is therefore better, like it would be from meat, from cow or pork or chicken. So the chelated form is the best form to go in terms of supplementation, and it just so happens that it mimics the way we have the iron present in our meat naturally.
And again, the final question with iron has to do with safety. The RDI is 18 milligrams per day for adults. Beyond that, are there issues or concerns if you were to take more than that?
Well, there could be, but truthfully, if you're taking the chelated form that Albion produces, the danger is really, really reduced, because what you find, and we've done clinical studies on this, when we were obtaining our GRAS, generally regarded as safe rating of Ferrocal, which is the trade name for this iron glycine chelate, that the better your body's balance of iron. In other words, the more your hemoglobin and hematocrit levels are, and your storage forms of iron are, the lower the amount of the iron as a chelate will be absorbed in kind of a natural protective mechanism. But if you take inorganic forms, you can run into trouble, more so than you would with the chelate. They don't like people to take much more than 30 milligrams a day without a doctor prescription.
Okay, thank you, Max.